Hello friends, let us now learn some important points about acute pancreatitis. So, acute pancreatitis is, as the name says, it is acute and it is pancreatitis means inflammation of pancreas. So, it is an inflammatory process. It is an inflammatory process of pancreas with involvement of different organ systems. So, different organ systems might be involved, and in acute pancreatitis, it is associated with increased pancreatic enzymes in the blood and urine. So, it is an acute inflammatory process with involvement of different organ systems and with with raised pancreatic enzyme levels in blood and urine is called as acute pancreatitis. It is a definition which is proposed by International Symposium on Pancreas. So, this international symposium was held in 1992 Atlanta. So, in 1992 Atlanta International Symposium, this acute pancreatitis definition is given. Then, in patients presenting with acute pancreatitis, this acute pancreatitis is a benign disorder and it is actually a self-limiting disorder. So, it gets healed on its own. But if the pancreatitis or acute pancreatitis is severe, it might become fulminant, and during this time of fulminant infection, the whole organs of all the organs of the body might be involved, resulting in multi-organ failure, and finally the patient might die because of this acute pancreatitis. So this is a condition where everyone has to be cautionate. So, mild acute pancreatitis. In mild acute pancreatitis, the patient will present with symptomatology, especially pain in the epigastric region, which is radiating to the back. And in these patients of mild acute pancreatitis, it resolves on its own. It resolves spontaneously on its own. And the main treatment of this patient is just supportive therapy. Then we have the second type, which is acute pancreatitis or acute interstitial or edematous pancreatitis. In acute interstitial or edematous pancreatitis, in this stage we see the changes in the gland. So the pancreatic gland might be enlarged and congested. Pancreas is seen in acute interstitial pancreatitis. Here there is no necrosis and there is no hemorrhage is seen in patients with acute pancreatitis or acute edematous or interstitial pancreatitis. Okay, then but these pancreatitis patients might also go through mortality or they might die because of certain complications. So the most common cause of mortality in the first 2 weeks is organ failure. Organ failure may result in mortality in first 2 weeks in patients with pancreatitis. Similarly, the most common cause of mortality in after first 2 weeks, in first 2 weeks it is organ failure. The most common mortality after first 2 weeks is infection. Then the next important thing is in mortality in acute pancreatitis, there is necrotizing pancreatitis. Necrotizing pancreatitis is more commonly might result in death. So, death is most commonly seen in necrotizing pancreatitis more than non-necrotizing pancreatitis. Obviously, the infection is severe in necrotizing pancreatitis than non-necrotic pancreatitis. Then it is more common in infected pancreatitis than non-infected pancreatitis. Then it is also more common in single organ failure. The death is more common in patients with single organ failure than with multi organ failure, though surprisingly. So these are the main important things about pancreatitis in the acute pancreatitis being two types, mild and acute interstitial and edematous pancreatitis. In the next class, we will learn some more important points about pancreatitis. Thank you.